Hello and welcome to this session on preparing for labor and birthing, what to expect, which is a part of Hera's pregnancy journey. Whether you're expecting your first baby or adding to your family, this base is for you. In this webinar, we'll talk about what it really means to prepare for labor and birth. What is it that childbirth classes really offer, and how they can help you to feel informed, supported, and grounded no matter how your birth unfolds. I am Anisha Siddhu. I am a childbirth educator and doula. My journey in this work began with the birth of my own children. And like many women, I entered labor with a lot of questions and a little bit of fear. But I have witnessed firsthand and I have experienced firsthand how powerful it can be when a woman feels prepared in labor and when she feels supported, and how she can move from fear to fierce confidence simply by understanding what is happening in her body. Since then, I have been supporting many families to tune into this inner wisdom, to make informed decisions, and feel confident in their birthing journeys. So, let's start by talking a little bit about this inner wisdom of birth. So let's take a moment to first reflect on something deep, something that is often forgotten in the fast paced medical world. It is the fact that birth is not a medical event, it is a physiological process that a woman's body is built to do. So long before we had medical advancement or we had apps, a woman's body knew how to give birth. And this natural knowledge is still within you. So, when we are able to really understand this natural knowledge, when we are able to support the physiology of birth, that's when birth works best. When we support the natural process, the physiology of birth, then the natural hormones of birth work in perfect harmony. That is when breath, movement, and rhythm come very instinctively. And in this whole process, if a woman feels safe and supported, then birth and labor progress very smoothly. So, this is what childbirth education helps us to reconnect with. So, childbirth classes are not just about textbook knowledge, or knowledge that is already available on Google. It is really about tuning into this wisdom and believing, really trusting your body's wisdom. So, I'd like you to take a moment to reflect on the following questions. What is it that you believe about birth? And where do these beliefs come from? As you reflect, you will probably notice that these beliefs come from the stories that you might have heard, the things you might have seen, or even fears that you didn't know exist within you. With childbirth education, you are able to really explore these beliefs in a safe and non judgmental space and also reflect on those fears and replace them with confidence and belief. So, now let's look at what childbirth classes really offer. So, first of all, childbirth education, unlike the popular belief that childbirth classes are all about pain management or understanding pain, first of all, childbirth classes, as we said, help us to reconnect with the inner wisdom of our bodies. Childbirth classes help to, one aspect which is often overlooked is that it is believed that the baby is a passive passenger in birth, which is not true. A baby is very much an active participant in the process of birth. And in fact, I like to call this a dance. Labor is a very beautiful, intricate dance between a mother and a baby. And when you recognize that, when you're able to really connect with your body, connect with the baby, that's when a lot of uncertainty and fear goes away. So childbirth classes help you to understand what really happens in the body, not just in labor but leading up to birth. How the body prepares itself for birth. You understand what is normal, what is to be expected, or when is it time to go to the hospital. And of course, when we understand that the baby is also an active participant, or we understand how the baby works in rhythm with the mother's body in really navigating the birth passage, how it rotates and twists and turns, and how the mother, through her own breath work, through movement, and staying in touch with her inner self, can help the baby in that process. So, in fact, I remember one mother who had attended my birth class. She really lit up at this idea of being connected with the baby. She realized that how she's birth is not something that she has to do, which is something that she and the baby will do together, and that brought a lot of calm and confidence for her. And similarly, uh, birth is not, childbirth classes don't just help mothers, they also help fathers. So I remember one partner telling me that, understanding birth and understanding what is going on in his partner's body helped him to stay calm, when it was time to go to the hospital. Unlike what we see in the movies, there was no panic. And so, while birth is a natural process, and it's important to stay with the physiology of birth, it is definitely also an intense experience. And so, in childbirth classes, we do talk about pain management, or rather, how to stay with the rhythm of labor. That is, comfort measures which help us to stay in rhythm. There are many comfort measures such as breathing, movement, changing of positions, etc., which we'll talk a little bit about more in detail in a little while. And in childbirth classes, you also learn how to evaluate medical procedures, how to be able to ask the right questions and be able to make informed decisions which are in line with your beliefs and your values. And of course, childbirth classes don't end with uh, the birth of the baby. They also talk in detail about the fourth trimester, which is the uh, part after birth, whether it's the part immediately after birth or also talking about the needs of the newborn baby and, of course, the physical and emotional well being of the mother. So, this is what childbirth classes offer. And but let's now look at what is the first step of preparation for birth, or rather, what is the first step for preparation for anything? It is to have a plan. So, let's talk about birth plans. So, what is a birth plan? A birth plan is something that you use to express what is most important to you. What is it that you would really like during your labor and birth? It helps you to reflect on what are your values or your priorities. It helps you to think about not just what you want but why you want it. It helps to ask yourself questions. What is it that would make me feel safe and respected during labor? So, for example, you could maybe perhaps you want very minimal intervention during birth, medical intervention, or maybe you want to list down all the pain relief options that you will opt for. Or perhaps you are very keen on having an undisturbed bonding time with the baby once the baby is born, immediately after the baby is born. So, for example, one mother that I had supported during labor as a doula had a very specific requirement. She was very keen on having dim lights, soft music, and minimal talking during her birth. So she was very specific about the kind of environment she wanted. And this is something she had discussed with not only her doctor, but her husband had communicated this to the birth team during labor. And so we all of us ensured that the environment remained as she wanted. And this is what helped her to feel calm, centered, and she was really able to uh, work more effectively with her body by focusing inwards. So, not only does a birth plan value uh, your preferences, but birth plans are also very importantly a great communication tool. There are two-way communication tool where you not only clearly convey your preferences to your doctor or your midwife, but you also understand the hospital protocols or policies or limitations on the part of perhaps your doctor or the hospital. And so, in that sense, birth plans are flexible. So, for example, one couple who had attended my childbirth classes, one thing they were very keen on having on their birth plan was minimal uh, monitoring of the baby. So they did not want the baby's heartbeat to be monitored too often, only intermittently. So this is something they had discussed with their doctor already. However, before labor, just before, a couple of days before the due date, they had to undergo a medical induction for some reason. And while they were discussing that, they uh, it came to their awareness that it is part of the hospital's protocol to do continuous fetal monitoring in case of an induction. So while they were while they became aware that they would have to have continuous fetal monitoring, but they also discussed with their doctor at that point that how with that they can somehow ensure movement and somehow ensure that they are not restricted to the bed. And so this way they were able to meet the doctor halfway and, still avoid any stress on the day of the induction. So now that we have understood birth plans, in order to make a birth plan, it's important to understand the tools that are available in our toolkit so that we can think of all the options. So let's talk a little bit about uh, the tools that are available. So, just like we have to, as part of preparing for labor and birth, we have to pack a hospital bag. Like that, in preparation for labor, there are many tools that uh, birth preparation or childbirth classes talk about. And these include not only physical comfort, but also grounding support. So, there are many tools available in the toolkit. There are only a few mentioned here. So this includes everything from comfort measures, which again we'll talk about in detail, like breathing techniques, water therapy, movement, etc., and also medical tools such as epidurals and other pain relief options. It also includes emotional and informational support. So right from deciding your care provider or your doctor to who is going to be in your support team, whether that's your husband or a doula or both, and even deciding the environment in which you'd like to give birth, whether it's going to be a hospital or a uh, birthing center or maybe even your home. So these are the kind of tools and options that you walk through during childbirth education so that you're not hearing these terms for the first time as you go into labor. And once we are aware of the options, with so many options, how do we decide what is right for you? So, this is where informed decision making comes in. So, informed decision making means understanding the benefits, the risks, the alternatives of every option so that you are able to make decisions that are in line with your preferences, your vision for your birth. And this is a time to where you can ask yourself, how do I feel about this? How does it align with my values? So, for example, suppose you have a very smooth pregnancy, and you're approaching your due date, but for some reason, the doctor offers an induction at 39 weeks. So, informed decision making at this point would look like asking the right questions. Maybe firstly doing your own research, finding out evidence-based information about inductions, and then communicating with the doctor and asking questions such as what are the benefits of this, or what are the risks if I wait, or what are the alternatives, or maybe if it is it really urgent, or do I have time to think. So, when you approach decision making in this way, you're able to participate actively in the birthing journey. And it is in childbirth classes that you practice this kind of decision making in a uh, safe and supportive way, so that when the time comes in a real life situation to make those decisions, you're able to respond and not react. So, having spoken about the various tools in the toolkit, in this webinar, we'll talk about some of the tools available uh, as comfort measures to help you through the intensity of labor. So, let's talk about those. So, first of all, the idea of using comfort measures for during labor is not just to manage pain, it is to really help help the body to stay in rhythm with labor. So, while labor is intense, it is not something what helps or what eases pain in a natural way is when a woman's body works with the rhythm of labor rather than fight it or against it. And so at this time, your breath, your body, movement, even your voice can be powerful to ease. So in childbirth classes, you learn uh, simple yet effective ways of breathing, whether that is slow abdominal breathing, deep abdominal breathing, slow exhalation, or whether it is patterned breathing and breathing with an open jaw, which helps you to relax the whole body, including the pelvic floor. And not only does breathing help you to relax, it also helps to ensure that oxygen reaches, the baby gets enough oxygen at all times. Similarly, movement is also is a key part of labor, which again not only helps with the pain management, uh, taking on different positions, and again positions that are not uh, told to you of what position to get into, but something that you're able to go with your instinct. That helps with managing pain, and also movement is a great way to help to stay with the gravity and to help in the process to help the baby navigate the birth canal. And of course, sound. So whether it is a hum or a sigh or a low moan, vocalizing during contractions is a great way to uh, keep the to keep the body relaxed, and like I said, uh, at the same time to keep your pelvic floor open. So all these techniques are help in what we call avoiding what we call the fear pain tension cycle. So when there is fear of the unknown or when there is unpreparedness, it can lead to tension in the body. And when there is tension, it leads to pain. So this is a cycle which a lot of times we can get stuck into during labor. But when we remind ourselves to breathe, to move, to stay in rhythm with the body, then we can break the cycle uh, and smoothly go through labor. And of course, while these tools are already available to you, but labor is a teamwork and we shouldn't have to do it alone. And this is where having a support system, whether it's in the form of your partner or doula, can make a huge difference. So, uh, your support people can help with the intensity of labor with a massage, certain counter pressure techniques on the lower back, with hydrotherapy, with hip squeezes, with warm compress or sometimes a cold compress. And so, this is what in childbirth classes, not only the mothers but also the partners learn, of what to use at the right time, and so everyone feels confident when the time comes. So, in really, making a sort of a mental checklist of what comfort measures you will use in labor, it's great to, again to tune in and ask yourself, how do you handle physical discomfort? And what is it that helps you to calm down and feel centered? So, however, these are physical comfort measures, and birth does not just happen in the body. Your mind plays a very important role too. It can either pull you towards pain or help you to stay grounded. So that is why, mindset tools are also a very important part of your birth preparation toolkit. So let's talk about those. So, like I said, that labor is intense, your body works hard, and your mind, which also plays an important role, can either fuel fear in the body or it can help it to ground with trust. So, in childbirth education, in childbirth preparation, you also learn about practices, grounding practices such as affirmations, visualization, mindfulness, which help you to go back to understanding what's happening in your body. You learn how to focus to anchor yourself, whether it's with a breath or a sound. And when fear comes in, uh, you practice ways of not fighting it, but coming back to your center and your grounding again and again. And this is, like I said, again, where your birth support team, your partner doula, play a crucial role. So let's talk a little bit about the how the partners benefit from birth preparation. So a good childbirth class is one that is not just for the mothers, but it also which also insists on the partners joining in and learning. So I'll give a real life example where a couple in my class, the partner had joined the class, but he was very hesitant and he was unsure of how he was going to support and whether he'll be able to support in the right way, or he was afraid that he might say the wrong things and he thought that perhaps I'll just wait outside. But as he attended the classes and through the weeks of the classes, as he learned about how birth unfolds and as he practiced hands-on techniques, comfort techniques, he started to ask questions and he started to understand how he could control his wife or how he could support his wife without stepping into control. And in fact, when the day came, and this is the feedback that I got from his wife, that he was absolutely hands on. He was there through every contraction, reminding her to breathe, giving her a massage whenever required, and most importantly, reminding her that she was doing it and that she was doing great. And his wife told me later that she couldn't have done it without him, and because he's the one who helped her to feel to stay grounded. So, as we see that childbirth classes not only just prepare the mother, they also prepare the partner. So, and so in childbirth classes, partners not only learn how to not only learn what or what to expect during labor, how to support physically, emotionally, but a very important aspect is how to be an advocate, because in labor, when medical decisions have to be taken, it is difficult for the mother in labor to communicate, and that is where partners play a very important role in facilitating this decision making, in communicating calmly with the medical team, with the doctors and the nurses, and so that is great part, a very important part of preparation for partners. So, when we think about childbirth classes, we often think that the focus is on labor and pain management, etc. However, a good childbirth class doesn't just stop at birth. It walks a little further and does talk about the fourth trimester, that is the time immediately after birth, and also the early days of parenting and postpartum. So, in childbirth classes uh, for postpartum, we learn things from uh, the immediate postpartum, that is, immediate the what is known as the golden hour as soon as the baby is born. It is known as a golden hour because it's a golden time when the baby has just come out, and it's a time uh, for you to bond with the baby. It's a time for the baby to feel safe on the mother's skin. It is a time for, when the baby is with the mother, it helps the baby to regulate its temperature, to start breathing, and it is also a very important, a crucial time to start breastfeeding. And of course, this is the part immediately after birth, and it is also good to know about what to expect, uh, especially if you're a first time parent, what to expect in the uh, early postpartum, in the first few days and weeks of postpartum, when it's everything is very blurry. There's a lot of physical discomfort, there's lack of sleep, but at this time, to understand basic things like baby's feeding cues, maybe basics of breastfeeding, what is normal and when to seek support, understanding basics of baby's sleep patterns, and of course, you know, there is no perfect way of doing things. Again, learning about the fourth trimester is also really about tuning into your instincts, and then be able to understand how to support the baby. And of course, in the postpartum, while everyone is focused on the baby, don't forget that the mother, the birthing mother, is also healing, and she has birthed not just a baby but herself too, as a parent. So, postpartum is a time of deep physical, emotional, and hormonal changes. Uh, there are breastfeeding challenges, there are physical discomforts and recovery, and of course, there are mood shifts because of all the hormonal changes. And it can feel very overwhelming if you're not prepared. So, in childbirth classes, you learn about the basics of postpartum healing and care, and also really preparing for that part with really thinking about who's going to be part of the support system. Planning your village. Who's going to be there to not just take care of the baby but also take care of you. And when the mother is taken care of emotionally, physically, it definitely reduces the chances of postpartum depression and anxiety. So, we talked about preparing for birth. So, I just want to give an example of one of a couple who had attended my childbirth classes, and they were one of the things they were really keen on was an unmedicated birth. And this mother went into labor or spontaneously. She labored beautifully. Everything was going very smooth. However, after many hours of very slow progress and labor becoming intense, she chose to go in for an epidural. And even though she had hoped for an unmedicated birth. However, instead of feeling disappointed, she felt happy and in control. And why is that? That is because she understood her options, because she had made the choice consciously, and she knew, the benefits, the risks of making that decision. And what she told me later is something that is always, I'll always remember. She said that I knew what was happening. And I made the decision with full awareness. And that is what made all the difference. So, because she was a part of the decision making, right? So, what I want to convey here is that even with all the preparation, the fact is that birth is unpredictable. That's very true. Even with the most detailed birth plan, or the best of preparation, labor can unfold in ways we have not expected. But unpredictability does not have to mean chaos, especially when you're prepared. So, this is also another very important aspect of birth preparation, where you understand why sometimes certain medical interventions or certain medical procedures are required. And even at that time, how to be able to make an informed decision and to still stay grounded and uh, feel confident about the decisions you're making. So it's really about uh, feeling empowered even when plans evolve. As we come to a close of this workshop, let's look at some of uh, the things we have learned. So, we have explored today what childbirth education really offers. And it's not just a list of facts or textbook knowledge, but it's really a foundation of confidence. We have seen how childbirth education helps us to demystify labor and birth, uh, how it helps you to connect with the body, how it prepares you to make decisions, how it prepares you with tools to help you cope with the intensity of labor, how they equip the partner to support their partner in labor, and also how childbirth classes help you to understand how to support your uh, parenting and postpartum journey. And we've also learned that birth doesn't go or always go as per plan. But if you're prepared, you can meet the unexpected with awareness and calm. Because ultimately, childbirth education or birth planning is not about scripting your birth, it's really about deepening your connection with the body, with your baby, with the choices, and with your support system. So, if this workshop has resonated with you, I invite you to take the next steps. Perhaps explore a class near you. Find one that matches your values and your learning style. Ask questions about what is it that is going to be covered in those classes, whether it includes the partners, and most importantly, trust that your preparation matters. Thank you for spending time with me today, and I wish you strength, clarity, and awe as you walk on this powerful season of life. Thank you.